Absolutely. All right. Last one of the day, guys. What to do with sick animals. Thank you guys for joining me in this journey. Contents for our last little talk here. We're going to look at how to identify sick animals and some common presentations, antibiotic stewardship, and then working with the veterinarian. All righty. So, identification. Is he sick? This ferret definitely sick. It is different based on species. Common concerns that we see: anorexia, lethargy, weight loss, dyspnea, um, very general signs. And we obviously see it every single day. Can be very difficult in our non-traditional pets. Prey animals, as most of them are, not this guy, but most of the other ones, like to hide their illnesses. They often like to just hide in general, and some of their changes can be subtle. It can they can be sick for, incredible periods of time and not tell you that they're sick until the last moment. And at that point, they're at the disease, point in the disease process where it's much more serious. So, does he need to be seen? I'm going to go through a couple of scenarios here. First one's a rabbit not eating. Tell me if you've seen this one before, because I certainly have. How long? This one's just 2 to 3 hours. Owner doesn't know if he's producing stool. Last offered food this morning. So for this guy, maybe clean out the litter box, offer some grains and treats, maybe do some hand feeding. If you're comfortable, take a temperature. We do have some educational videos on taking temperatures, and we work with rescues that are comfortable taking temperatures on rabbits. Typically a two-person job. Give this guy a little time, see if we can see some poop, see if we can see some eating. If not, definitely need to be seen. If he starts to nibble, starts to defecate, there are some options to support these guys at home. Hand feeding, as long as they're pooping and they're bright and feeling better, is a viable option to help them through some lesser bouts of RGIS. All right, moving on to our next one. Oh, sorry, that's right. Quick note on hyporexia, not eating. How long is too long? So in the majority of our patients, if we're getting to the 12-hour mark, we're not eating very well, not feeling well, should absolutely, if you haven't already, contact the veterinarian and bring them in. For some of our carnivores, can go a little bit longer, but again, stay in contact with a veterinarian. This is a huge disclaimer that these animals, they don't always show their signs and can be sicker than they appear, and communicating with the veterinarian is pretty crucial. Reptiles, chelonians, specifically, can go a little bit longer, and then snakes, they're not fed as often, so can go very long periods of time where they're not eating. But definitely take the whole picture into consideration when you're thinking about talking to a veterinarian, and always err on the side of caution. A phone conversation is very easy. All right, next one here. We have a female guinea pig that is constipated. We'll get this one a lot. They'll say that they're constipated. They've not been eating for over a day, not producing any stools, and they haven't seen them urinate at all. This is a pretty crucial point here, because this is probably the most common, I guess, presenting complaint that the owners will say, that we have a urinary tract obstruction or a stone in a guinea pig, whether it be female or male. And this patient should be seen right away. Their urinary obstruction is common and very fatal. So got an x-ray, we can see here, look at that stone, right where we don't want it to be, completely obstructing the urethra. Now in a female, this is something where we can get creative. And wow, that looks like a horrible device, but really, really helpful in getting these stones out that are very painful and just right on the inside of their urethra. Their urethra is very short in these females. It's got a pretty decent sized diameter. And this is definitely a procedure where you're going to want to get them under anesthesia, give them local pain medication, lidocaine, bupivacaine, whatever you have. Try to be as gentle as you can, but also try to succeed with what you're doing, and flush the area afterwards. And expect that afterwards we're going to have a little bit of blood in the urine for a few days to a week, and that this is something that can happen again. So moving right along here, prolapses. happen all the time in our animals, seems to happen in reptiles a little bit more often. And some cytosines with dystocia as well. But how long, we've got two cases here. Looking at the left here, we have prolapse that just happened. It's maybe just a little bit of kind of a puckering out. It's nice, pink, healthy tissue. It's moist still. Animal doesn't even realize it's going on. So in this circumstance, if you have a good water-based lubricant, never use Vaseline, never use anything that's got anything like that in it, because it can be detrimental to that tissue if it goes back inside the animal or if there's any sort of rupturing. So water-based lubricant, warm water soaking, no additives are needed there. And if not resolving pretty quickly, I don't like to give it, an hour or more. Seek veterinary help, because we definitely want to get that prolapse in before it becomes an issue, which is the second side here. We've got a prolapse that's been going on for 2 days. It's 3 whole centimeters on an animal that's, let's say, twice that long. So it's a big prolapse. It's dark, it's red, it's crusted. This tissue is looking like it might start to die off. So this is an animal that needs to come in immediately. Unfortunately, in a lot of these cases, this is an animal that's very, very sick. It's got diarrhea, it's lethargic. Our options are limited. Often we'll have to go to surgery, and often that might not be something that's particularly successful. But this is something you're going to want to keep in mind here with time frame. Prolapse time frame is big. We want to be quick on those when the tissue's nice and viable. And if it's a scenario where it's overnight, they can't get into the hospital, that water-based lubricant can be super helpful. So, do the best that you can. Fractures, dyspnea, other very common, things that come in. Fractures, pain medication. Fractures are so painful. Pain medication is crucial. There's going to be that knee-jerk reaction to look in the medicine cabinet, give ibuprofen. That's going to be a big no-no for a lot of our animals, because there are some reported dosages that are okay, but it can be very hard to dose that appropriately. And a lot of these animals with those medications can have very severe side effects and can have a worse issue, and they can be fatal based on getting that medication. And if you have an NSAID and it's for a pre-existing condition, you can give that if you haven't already. But big thing's going to be getting strong pain medications from a veterinarian. This is one where it's not a fatal emergency, it's just really painful. So if it's an overnight situation, it's going to be tough for them to get to the hospital. Very confined area, small, well padded area, and just support them, make sure they've got food, water close by. And a lot of our small animals, fracture repairs are doable, but can be challenging. But fortunately enough, they tolerate amputation awesome. A lot of times that'll, I won't say it's my go-to, but I will talk to owners very seriously about that right away, because I've got dozens of rabbits that have 3 legs and they are so happy. You wouldn't have known that they do anything differently. So keep that in mind. Dyspnea. There can be different levels to this. It's so common in our small rodents, where the big thing that I'll be looking out for with dyspnea is if they're also eating at the same time, because if they're breathing harder, but they're feeling comfortable enough to eat, a lot of times it can wait a little bit longer until maybe an appointment. But if they're open mouth breathing and they cannot get to food, they need to come in immediately, because that can be very serious very quickly. Nebulization can be one thing that you can help them out with. It might help alleviate some of their symptoms. And this is something you can do at home. If you've got a steam shower, it works really well for humans. It works very well for animals. Might as well utilize that. And the way I do that is, put their enclosure in the bathroom, turn the shower on high, get some steam going in there, turn the vent off, or you just make sure it's appropriate so that it gets a little steamy in there, and that can help loosen up some of that discharge, sneeze it out, that type of thing. If you're, someone who has a lot of rats or guinea pigs that get these issues a lot, you might have a pediatric nebulizer, and there's a good way to set this up where you can kind of make a little steam environment for them where they can have food, water, and they can be in this environment that you can put saline that you can oftentimes get at the store into the nebulizer. And only trouble I would say that you can run in with this one is that I've seen it more in the last year to 6 months, but pharmacies will be getting a little bit stingy about this and want to get a prescription. So if you don't have it already, you will oftentimes need some sort of prescription from the veterinarian to get this. So that is something to keep in mind for that. All right, so going off that last disease, dyspnea, not wanting to give them antibiotics, moving into antimicrobial stewardship here. So historically, there has been a lot of antimicrobial resistance, and I've got kind of a list here dating back to 1940, starting with penicillin, something very common to use, but there are several different resistances here, from bacteria that are naturally resistant to things that have developed. Moving right along, you can see tetracycline, erythromycin. It's nicely color coded here, so you can tell which one is which. But bacteria find a way to find resistances, and it can be natural and it can be unnatural, and it's happening with higher tier antibiotics, which can be very, very serious. And how serious is it, and how does it happen? So, as I said, naturally, it can occur in some bacteria, but it can be acquired too. They can acquire genes for deactivation, something like penicillinase, or they can get efflux pumps, which are just getting rid of the antibiotic or just moving things out that they perceive as a threat. And bacteria can have plasmids, which can transfer resistance from one bacteria to another, that DNA, to help it spread and help more bacteria become resistant. So it can happen quickly with these very small organisms, and it can be very serious. In 2019 alone, 1.27 million people died directly from bacteria that was highly resistant. And there was an additional 5 million deaths that were associated with some sort of antimicrobial resistance. Maybe it wasn't the primary issue, but there was bacteria associated with the issue that led to death. So it's very serious. And it's just a year alone. So how does this happen? Overuse of antibiotics. Antibiotics, I've been a culprit of this myself. It happens everywhere. Human, animal medicine, antibiotics work really well for infection, and a lot of them are a very broad spectrum where they can cover multiple different bacteria. So there's definitely, a response to if an animal has specific symptoms or we don't know what to do to try an antibiotic. And we can run into problems with that a lot if we're not picking the correct antibiotic, or if we don't do it for the right amount of time, or what have you. And humans can come in contact with these resistant bacterial organisms, and they can touch other humans, and our food animals or just pet animals can harbor these bacteria, and it spreads, and the antibiotics are not totally getting rid of it, and it becomes a huge problem. So that's why we need antimicrobial stewardship. So veterinarians, those in the animal care community, need to keep something like this in mind. Using the right antibiotic at the right time, at the right dose, for the right duration. And it's one sentence, but it's difficult. It's very difficult to do that in a lot of circumstances. And in 2017, the University of Georgia Zoological Medicine Service did a review of their cases, and almost all of them were on antibiotics. Many of them probably didn't need them. Many of them probably were given the wrong one. But they tried to develop a policy where veterinarians should prescribe antibiotics when we're preventing infection or treating bacterial disease that is confirmed. 'Cause So what exactly does that mean with preventing infection? So these are instances with high rates of infection. So very long abdominal procedures or orthopedic procedures. So, one dose of an antibiotic intra-op is an appropriate thing to do. And we'll want to refer to this tier list that we have here, 3 different tiers. And I use this all the time in practice because I'll often run into situations where, it's been a long procedure, or it's an orthopedic procedure, or where, even if we're doing a culture, a tier 1 is very appropriate to do in the interim because it's an animal that's very sick, and we want to have them on something while we, wait for results, or if it's a disease that has a very high prevalence for, a handful of bacteria that respond very well to certain antimicrobials. I'll reach for this section right here. This is our go-to. This is, what you want to go to first. These are, lower tier antibiotics that won't potentially cause as much of a, I guess, if there's bacteria that we're trying to treat, there won't be as much of an issue, as much resistance, as much disease if we're going towards this tier. So these are instances of prevention, those intra-ops, and the first line, as I kind of said. So tier 2, ideally we'll want to use these in situations where they're sensitive on bacterial culture and susceptibility, and tier 1 is not effective. Now you'll notice a couple of heavy hitters here that are used very often. 2 of them being ceftazidime and enrofloxacin, used very commonly in practice for, a lot of reptile species and for just species in general. Batril, go to it all the time. It is very effective, crosses the blood-brain barrier. It checks a lot of boxes, but it's not one that I will, with everything I have, try to avoid that as a first option, unless there's a culture telling me that it is the most appropriate to use. And then tier 3, these are things that I don't think I've actually ever used any of these, but if there is a very resistant bacteria where this is the only thing that's going to work, that's where we're going to use. All right, implementation. As I've kind of alluded to, in an ideal world, it's very difficult, but bacterial culture and susceptibility prior to any antibiotic use would be the ideal to try and, prevent an issue with all of this antimicrobial resistance. But in our worlds, I mean, it's not very feasible. It's not practical a lot of the time. So there's a list of different situations where I like to go to tier 1 antibiotics, and they include, a lot of respiratory issues, kind of that first time coming in where we're pretty, we're in a situation where we're worried about bacterial infection. A lot of those otitis media, internus situations with guinea pigs. I kind of talked about that a little bit earlier. Sepsis is a big one. I will try, if I'm suspicious about sepsis, to put them on this. A lot of times in sepsis, I'll use a multimodal approach with multiple antibiotics to do the best I can because this animal is incredibly sick. But in those situations, we want to have good evidence of sepsis, and we want to have things like hypoglycemia. We want to have, a blood smear that's got either a significant toxic heterophil with a very, very high count or very, very low count, hypothermia, lethargy, a lot of different things. You need to make sure you're pretty confident about that sepsis before you start putting them on multiple antibiotic protocol. And then those intra-ops are also a good opportunity. And the other things would be severe immunocompromised patients. So patients that might be on a chemotherapeutic agent, and you're doing routine CBCs in there, white blood cell count is very low, they're going to be very susceptible to infection. So it is appropriate to give a tier 1 antibiotic in that situation. All right, so working with the vet, the last little section here. All right, so suspected infection, I've kind of talked about this ad nauseum, but consulting a veterinarian is a great thing to do. There's a lot of veterinarians out there. They want to help you out, at least they should. culture and susceptibility whenever possible. Tier 1 antibiotics, those are the ones to go to. I will say one that works in a lot of species is a trimethoprim sulfonamide or a potentiated sulfonamide. Those can be a great tier 1. So base selection on the suspected bacteria and target organ. There are those target apps. There are different ways that you can find out what's going to work best for a specific organ and a specific suspected bacteria based on, literature as to, if they have this disease, this is what bacteria affects this organ the most. Let's use that bacteria, or not that bacteria, sorry, that antibiotic. And I think probably one of the most important things is using the right antibiotic as opposed to not using an antibiotic at all, because as veterinarians, we want to help. There's a lot of situations where, a bacterial infection is likely happening, but we always want to make sure we choose the right one. Just remember that tier, that first tier. So for large collections and working with veterinarians, how can we help each other? So these would be breeders, rescues, backyard flocks, zoos, etc. Just someone that's got an enormous amount of animals that happen, to just be all over the place. Happens all the time. Many veterinarians, local and state, some referral centers are willing to work alongside these groups at a discounted price. A lot of our rescues, we will, if they're reputable, work with them and they get discounted rates. A lot of people that work in the veterinary community, get discounted rates if they come to our hospital. And I've seen that at many hospitals that I work with. We want to help each other and we want to address, these issues with large groups and antimicrobial resistance, and work together to best establish the best biosecurity and husbandry. It's mutually beneficial. And I talked about this earlier. I believe someone asked a question about biosecurity in these large groups. So things like keeping people that are not familiar and come in contact with these animals out as best you can, making sure that they follow a protocol. They need to wash their hands, they need to change clothes, or they need to wear PPE whenever they're going to be in contact with your animals, because those are your animals and it's your responsibility to keep them safe. And as much as it may be a pain in the butt, you have to lay the smack down on them. You gotta tell them what's what and take care of your animals first and foremost, and yourself, because if they get a disease, especially a zoonotic one, you could become infected by that as well. And then vaccine protocols, prevention with any sort of dewormers. Talk to a veterinarian about doing those things and they'll be happy to help you the majority of the time. And then without further ado, that is everything. So if there are any questions, I can field them.
You've got one question.
Yes, we have a question for you. Hang on just a minute. Any comments regarding the recently imposed ban on OTC sales
That's right.
of antibiotics at feed stores, animal product suppliers, etc.?
Yes, so I did see that there's a new FDA farm regulations that all antibiotics should be going through a veterinarian with a prescription, and I am in support of that. I do think that it does put a lot of people in a difficult situation, but because the antimicrobial resistance has become so much of an issue, I think it's a way that the FDA is trying to combat that and do what they think is best to prevent that from happening.
Okay, thank you, Jeffrey. Do we have any questions? If we have any questions, put them in the question box and we'll answer them.